You know, when I think of Congresswoman Mary Jo Kilroy, I can think of two words that go together very well. Kilroy, courage. Kilroy and courage. The courage to do the right thing for the folks in her district and for America. The courage to stand up against vicious attacks and statements. And the courage to vote for health care. Ladies and gentlemen, let me bring forward to you a lady of courage for this congressional district, Mary Jo Kilroy.
About last August over at the state fairgrounds for a little rally before health care too. Thank you, Mayor Coleman, for the very gracious introduction, and thanks Senator Brown for being here in Ohio's 15th Congressional District and for your leadership in the United States Senate and helping bring us here to this state. I also want to thank my constituents, Bob Jacobson and also Ann and Penny and people who have shared their stories with us. It really makes a difference to hear that. And for me, as I do my work in Washington, those are the images that I want to keep in my heart and in my head to do our work. So that when I am making the decisions, it is you and your friends and your neighbors that I am thinking about. I also want to thank all of the activists. Thank you, Kathy and Lorraine and all of the groups, all of you. It's such a pleasure to be home and to be here with you. And I hope you know that this is your victory. In every way, this is your victory. You worked so hard for health care reform. And even before we began the serious work on health care in 2009 and 2010, I know you were out there knocking on doors and getting involved in certain campaigns so that we had a president who would sign this bill. As we listen to stories like Bob's and Ann's and Penny's and many others that I have heard during the course of the last several months, listen to small businesses, listen to seniors, listen to married people, young couples just starting out, listen to singles, and listen to the parents of those singles about the difficulties that they have had with this current health insurance system. Its high cost, its unrelenting price increases, how insurance companies denied coverage in so many different ways, and the attempts people had with coverage to get them to do what they were contracted to do, and how they had to fight to get their bills paid. I heard from a friend who recently battled his cancer. He called me the night before we were going to vote on the health care floor. And he told me about his battle. It turned out pretty well for him. His cancer's in remission. But his health insurance company canceled his policy, not just for him, but everybody who worked for him. A little gamut called rescission. And that's the wrong thing to do. And he wanted me to know that before we went there to vote on health care. I heard from people who lost their job and lost their health care coverage and were unable to get coverage they could afford, or, like Ann, were denied coverage because of a pre-existing condition. I heard from people who used up their annual or their lifetime caps as they struggled with cancer. People shouldn't have to fight like that as they're battling a disease like that. They shouldn't have to fight. coverage too. And I know that too many people here are just a pink slip away from being in that state of losing their health care coverage. I know these stories from listening to people at the town hall meetings that we held, the round tables, the constituent visits, the mail, and because I have seen and experienced some of these same things too. As a lawyer in a small practice, seeing our health care bills escalate. As a mother of 2 daughters in their 20s, I have worried as they start out in their careers whether they would have jobs with health insurance. And you may know I am also living with a pre-existing condition called multiple sclerosis. And I know what many with MS face, and I want each of them to be able to have, just as I do, the medications that can delay or prevent the onset of disability. Our historic accomplishment, what we did together, will change all of that. So we all have something great to celebrate here because this bill is going to improve the lives of all Americans. For seniors, a stronger Medicare, one whose trust fund will last longer, with an end to co-pays for preventive services, more primary care doctors and advanced practice nurses, long-term disability insurance that is affordable and that won't turn you down because of your medical history. My mother, she's now 86, I'm close to being Medicare eligible myself, frankly, still worries about me and her grandchildren, and she and other seniors won't have to worry so much because with this bill, their grandchildren and our children, young people up to the age of 26 will stay on their parents' insurance, and small business owners will get tax credits to help pay the cost of health insurance for their employees if they choose to cover them. And when the health insurance exchanges are set up, every small business will have the same insurance buying power as the biggest corporate giants in America. Individuals buying coverage on the exchange or companies buying coverage on the exchange will be able to look up the prices and the policies, just like we do now on Orbitz or Expedia or Travelocity when we're picking out a plane ticket. And we can get the best price or the price we want to pay for the coverage we want to have. You will choose. Healthcare choices are going to continue to be in your hands with your doctor, with the insurance company out of the picture now. Not only does this bill achieve affordable and accessible coverage with a choice of doctors and plans that helps young and old and in between, emphasizes prevention and contains costs, it is paid for and will lower the deficit. What is not to like about that? And this is just the beta version. We will keep working. We'll get a 1.0 and a 2.0 and keep improving this bill. As Kathy and Lorraine and others have said, we need to remain engaged on this issue. But in the meantime, let our family and friends know the real story of what this healthcare reform means for them. And when John Boehner and others continue to attack healthcare reform, let's just ask him, John, why don't you want us to have the same kind of coverage that you have? When John Boehner says, no, you can't, you are going to remind him, yes, we can. And yes, we did. So thank you all so very much.